Welcome back to our channel Dentistry to the Point. In this video, we'll be dealing with another chapter of medicine, that is your disorders of GIT or gastrointestinal system, for which the first topic is gastritis. Now, as I've mentioned earlier that before starting with any chapter of medicine, we'll be dealing with the intro first. But then what I found is that GIT in itself is a very big topic, which is going to be separately covered when we deal with physiology, the GIT physiology. So here, there it's going to be covered separately in much detail, and here the terms, confusing terms which come in between. So I'll give you the detailed explanation then and there itself. So we don't have to deal with the intro of GIT because it is very big, and the medicinal part of GIT, it does not actually include so much of normal GIT also. So related to the investigations and everything, I'll tell you in detail there and there itself. So let's get started. The word gastritis itself means, that is itis aa raha hai usme, matlab that is inflammation of the stomach or the gastric mucosa that is present. So there is nothing but inflammation of the stomach, and it can be of two types, namely acute, that is abrupt onset or for a short duration of time, and chronic, that persists for a longer duration of time. Okay, so we'll see both of them separately, starting with acute gastritis. Now, acute gastritis, as the name itself suggests, that is an acute form of inflammation of the stomach which persists for a shorter duration of time. And now, what is this? Now, why? Actually, the pathology, being it acute or chronic, so the pathogenesis is same. कि दोनों में क्या होगा कि there is disruption of the mucosal barrier or there is interference with the mucosal barrier system. Okay, so दोनों का pathology is going to be same, but the clinical features and the etiological factors are most commonly going to be different. So the pathology, the pathogenesis says that how this acute gastritis happens is that there is disruption of the gastric mucosal barrier, or there are things, the etiological things which interfere with the gastric mucosal barrier. Now, what is this gastric mucosal barrier? So it is nothing, it is just the property of the stomach, okay, which allows it safely to contain the acid which is required for digestion. Okay, again, what is gastric mucosal barrier? That is nothing but the property of the stomach which allows it to safely contain the acid that is required for digestion. Okay, if there is any disruption or this gastric mucosal barrier breaks, then the acid is going to diffuse and cause damage to the mucosa. Okay, now this gastric mucosal barrier, it is a complex of three protective systems or three protective layers. Firstly is your compact epithelial cell lining. Okay, so these epithelial cells which are present in gastric mucosa, they have tight junctions. They have tight junctions so that they can repel the harsh acid which comes and does not destroy the mucosa. So tight junctions ho gaya ek to first thing. Second is special mucus covering. So the superficial cells or the surface epithelial cells, they secrete mucus which forms a protected gel coating on the cells so that it does not, the acid does not cause any damage there. And third is the bicarbonate ions, or the ions which are secreted from the bicarbonate ions. Okay, bicarbonate ions are secreted from the surface epithelial cells which maintain the pH balance, so that अगर acid ज़्यादा हुआ तो वो secrete कर देगा bicarbonate, so जो mucosa है, it is not going to be damaged by the acid. Okay, so these are the three mechanisms which are involved in your gastric mucosal barrier. Okay, which allows your mucosa to store that acid and it does not harm the mucosa. Okay. अब इन तीनों में से if in any of the three is disrupted, so there is going to be attack. Okay, there is going to be damage of the gastric mucosa. So moving on to the etiology, like क्या चीजें affects these mechanisms. Firstly is your NSAIDs, that is your non-steroidal anti-inflammatory drugs, and analgesics, and also aspirin. Now these two are the most common cause. Aspirin and NSAIDs, these two are the most common causing factors for acute gastritis. Now what they do is that they interfere with the mechanism of gastric mucosal barrier. Okay, what they do is that they reduce the secretion of bicarbonate ions. मतलब they hinder with the secretion of bicarbonate ions of the surface epithelium, and then they cause damage. Okay, so inka is the most common factor, that is your NSAIDs and analgesics and your aspirin. So NSAIDs and aspirin are the more common factor or most common etiological factor for acute gastritis. Then comes your antimitotic drugs, renal failure. Like renal failure is how क्योंकि रीनल फेलियर्स में क्या होता है, इंक्रीज यूरिया लेवल हो जाता है बॉडी में, दैट कॉजेज योर डैमेज टू द गैस्ट्रिक एपिथेलियम. देन इज योर हेलिकोबैक्टर पाइलरी इनिशियल इन्फेक्शंस, अल्कोहल अब्यूज, अगेन आयरन थेरेपी, अगेन क्योंकि ऑक्सीडेशन ऑफ आयरन फेरस से फेरिक में होता है एंड फेरिक इज हार्मफुल टू द एपिथेलियम और कॉजेज डैमेज टू द एपिथेलियम. फॉलोइंग बर्न्स, दैट इज योर कर्लर्स अल्सर्स, जो कर्लिंग्स अल्सर्स होते हैं जो हम बाद में देखेंगे. पोस्ट ऑपरेटिव कॉजेज होते हैं, कुशिंग्स अल्सर्स होते हैं, बहुत सारे कॉजेज है. तो बट द मेन कॉज, द मेन etiology इज योर NSAIDs and that is your non-steroidal anti-inflammatory drugs and aspirin. These two are the main causes of acute gastritis. Also, one point to remember is that acute gastritis is usually diagnosed, that is it is usually seen on endoscopy. Okay, मतलब इसके जो changes है जब आप endoscopy करते हो, I'll tell you in investigations further कि endoscopy क्या होता है, what is endoscopy, how it is done, everything. But then one thing to remember is which is also a very good distinguishing factor for acute and chronic, कि इसको आप endoscopy मतलब you get to know this or you see these changes by endoscopy, but in chronic this is a histopathological type. मतलब आपको बायोप्सी और इसमें इसके चेंजेस देखने को मिलते हैं. क्रोनिक गैस्ट्राइटिस में you see the changes histopathologically, that is on biopsy and everything, but in acute you see on endoscopy. Okay. Now there are two separate terms again for gastritis. That one is known as phlegmonous gastritis. Now this is usually or commonly associated when there is streptococcal inflammation or infection of the gastric mucosa. कॉमनली इसको तब बोलेंगे जब आपको पता है कि जो इन्फ्लेमेशन हुआ है आपके गैस्ट्रिक म्यूकोजा का, दैट इज बिकॉज ऑफ एनी स्ट्रेप्टोकॉकल एजेंट. नाउ इट कैन बी ऑब्वियसली बिकॉज ऑफ एनी बैक्टीरियल इन्फेक्शन, ऑल्सो एनी अदर बैक्टीरिया कैन बी इन्वॉल्व, बट देन कॉमनली अगर वर्ड फ्लेग्मोमोनस आ रहा है तो बाय डिफॉल्ट इट इज सजेस्टेड दैट इट इज बिकॉज ऑफ एनी स्ट्रेप्टोकॉकल इन्फ्लेमेशन. Now this condition presents as an emergency or an acute abdominal emergency. Okay. Next is your acute erosive hemorrhagic gastritis. Now this is in etiology, in pathology, in pathogenesis, everywhere it is similar to acute gastritis, but the inflammatory things which are produced are very intense and severe here. क्योंकि नाम में ही आ रहा है erosions and hemorrhages, मतलब कि जो inflammation produced हुआ it is so severe that it causes varying number of erosions which bleed. क्योंकि hemorrhage भी आ रहा है, so it causes varying number of erosions in the gastric mucosa which also ulcerate and they bleed. So it is nothing but an intense variety, and this is more commonly, the etiological factor more commonly are these. That is related to your CNS or central nervous system manifestations like your burns, जो आपका Kohler's ulcers होते हैं. Then you have your post-operative causes. So these are morely associated with acute erosive or hemorrhagic gastritis. Moving on to the clinical features, so if it is a very mild form, then sometimes the patient may show asymptomatism, that is the patient may be asymptomatic if it is a very mild form. Otherwise the patient may present pain in the abdominal region with nausea and vomiting. Nausea is nothing but the sensation, again it is the sensation of vomiting and vomiting. Hematemesis means the vomiting which contains blood, the vomiting which has your gastric contents as well as blood, that is your blood streaked vomitus is hematemesis. Okay, so here it is going to be hematemesis, that is the blood. Also a specific feature could be coffee ground vomitus, that is that grounded coffee color, that is very brownish color vomitus could be there, or bloody aspirate on nasogastric suction. So Ryle's tube is an instrument which is introduced, and if you see you're going to get a blood aspirate when it's going to be put it into your nasogastric region and it's going to suction, so there is going to be blood tinted. Next is fecal blood loss, that is occult blood in the stools. Now occult blood का मतलब होता है the blood which is not seen by your naked eyes, or the blood like as in when बहुत सारे diseases है in which there is blood seen in the stools. Okay, so when a doctor sees blood in the stool, he is not able to like, he cannot say कि भैया ये blood कहाँ से है, मतलब he cannot just by seeing blood in the stools he cannot say कि okay it's a case of acute gastritis or chronic or duodenal ulcer anything. So that's kind of occult blood loss, that yes, a little of blood loss is also seen in the feces. Okay. Next is may lead to iron deficiency anemia in severe cases. So if there is a lot of blood loss, then obviously in severe cases there is going to be anemia. Moving on to investigation. So first is endoscopy. Now endoscopy are of two types. One is your upper GIT endoscopy, second is your lower GIT endoscopy. For upper GI endoscopy, you introduce the instrument that is your endoscope through your mouth, and for lower, you introduce it through your rectum or your anus area. Okay. Now here we are going to do upper GI endoscopy, obviously. So endoscope is what? It is an instrument, it is a flexible instrument which has to one end, मतलब एक end से तो introduce होता है, and the end which is introduced, it has a camera, a light, and a small instrument to pluck out any, like you find any erosal surface there, so you pluck that surface and keep, so that when it is introduced outside, that surface could be used for biopsy. Okay. So what is done? This endoscope is introduced from the mouth. From the mouth, it is introduced. So for this, your pharynx area is sensitized, as in it is a local anesthesia is given, and it is anesthetized, and then the instrument is introduced from your mouth region, which is then introduced through your esophagus. So matlab, it is going to introspect your esophagus also, then your duodenum, till duodenum it is introduced actually. So esophagus and your upper GI region, that is, वहाँ पे वो introduce करते हैं, so it sees any kind of erosions or hemorrhages it is seen, and also I've said that it has that instrument, so it takes if it sees any abnormality or nothing, like we can take any, if we see any abnormality, we can take that, so that you can be later on biopsy can be done of it. So this is how the endoscope works. So you do endoscopy. This is a very common investigation measure for diseases of the stomach. So you introduce an endoscope. So what things you can see through endoscope in acute gastritis is hyperemia. Hyperemia is nothing but when there is collection of blood or there is extra blood in a specific area. So when there is hyperemia, mucosal erosions, any kind of erosions are present in your gastric wall, hemorrhages, slow oozing of blood from the mucosal surfaces. Okay, these are seen. Then also, as I mentioned here, तो आपका जब blood आप stool test करोगे, so you're going to get a positive occult blood test in stools. मतलब blood is going to be present in stools. And if you do blood examination and if it's a severe case, then obviously it may reveal anemia. Moving on to the treatment for acute gastritis, obviously you have to first treat the underlying cause, which is your NSAIDs and aspirin, the most important cause. Also, if there is excessive consumption of alcohol, so that also has to be stopped. So, as मैंने भी बताया था, in pathology I've told that NSAIDs and aspirin, what they do that they inhibit prostaglandin secretions, which in order inhibit your bicarbonate production. Okay. तो आप क्या करोगे? Misoprostol, which is an prostaglandin analog. Okay. So you give this 100 to 200 micrograms 4 times in a day, so that ये जो inhibit कर रहे थे ये उसको oppose करे, and the bicarbonate ions are present or they are circulated in the normal range. Okay. Then you give your antacids, histamine blockers, antispasmodiacs for symptomatic reliefs. Obviously, spasms होंगे उसको control करने, जो muscle spasm हो रहे bowel movement की वजह से, that is your antispasmodics you give, antacids to relieve the acid content, and again that is H2 blockers or histamine blockers, which again reduce your gastric acidity. That these control your acidic content in the gastric mucosa. Higher levels, or if severe acute gastritis happens, then obviously anemia के symptoms आएंगे, तो blood transfusion करना पड़ेगा और IV proton pump inhibitors देने पड़ेंगे. Again, this will do nothing, but these control your gastric acid secretions, or they reduce your gastric acid secretions. तो इसलिए these are given. Starting with chronic gastritis, so one thing which I have earlier mentioned, that जो आपने acute gastritis पढ़ा था, that is seen on endoscopic examination, right? And this is more a histopathological variant which is seen on gastric biopsy. Okay, so now it is divided into two types based on the histological stage it is present on, and secondly the etiological classification or the etiology it projects. So based on the histological, based on the stage of histology which it is seen, so it is divided into three types. The first is chronic superficial gastritis. नाम से ही समझ आ रहा है chronic superficial gastritis है, मतलब कि ये कुछ initial gastritis है, it is not involving that deep of the gastric mucosa, superficially it is present. Okay, so here almost the mucosa is normal, but slightly it is patchy. Why it is patchy? Because of the presence of your inflammation of the gastric mucosa with lymphocytes and plasma cells. These are your inflammatory cells. Okay, circulating inflammatory cells जो होते हैं आपके, या chronic inflammatory cells जो होते हैं, that are predominantly your lymphocytes and plasma cells. So yes, these are present. That's why there is a slightly patchy appearance because of the presence of these. Second is atrophic gastritis. As several times I have told you, atrophy means there is reduction in the size or wasting away of the cells. So the thickness of the mucosa is reduced क्योंकि atrophy है. Obviously जो gastric mucosa का thickness है, that is reduced, and there is reduction. Because of this, there is also reduction in the parietal and the chief cells that are present in the body of the stomach and the mucosal cells which are present in the pyloric glands. Now, yes, this is an important point. Like the stomach is divided or it is sectioned into various parts like your antrum, the pyloric and the body of the stomach. So I'll pop an image here so that it's clear which is the body of the stomach, which is the pyloric air, which is the antrum. Okay. Also, the chronic inflammatory cell here, which were here present in abundance, are cell also seen here, and there is superficial metaplasia. Okay. Moving to the third variety, that is gastric atrophy. There is thickness of the mucosa which is further reduced. इससे भी ज़्यादा reduce हो गया है. The glandular element of the gastric mucosa is atrophied. That is reduced, and there is marked epithelial metaplasia. Here it was only superficial. Here there is marked epithelial metaplasia, and the chronic inflammatory cell infiltrate is slight here. Okay. Now, as you see the name here, it is atrophic gastritis, and when you reverse it, that is gastric atrophy. So sometimes these are used interchangeably, but then again, if this term is used, then this is a severe form of this term, because everything is more reduced here. That's why. Okay. Moving on to the etiological classification. So first you have type A, that is autoimmune. So this is also a cause for chronic gastritis, that is autoimmunity. Now it is always clear that autoimmunity is nothing but when the body immune cells, they start killing their own healthy cells, that is autoimmunity. So this type of gastritis में क्या होता है? So the autoimmune responses of the body, these are against your parietal cell antigens and they cause widespread parietal cell damage. उनके जो अच्छे parietal cells है, those are getting damaged in type A, that is autoimmune chronic gastritis. So obviously बात है जो parietal cell antibodies होगी, it's going to be the diagnostic of such type of gastritis. Okay. Now parietal cells, as you know, is responsible for the production of intrinsic factor. So obviously there is going to be reduced or loss of intrinsic factor, and also because intrinsic factor ka loss is responsible for development of pernicious anemia. So obviously there is going to be a condition of pernicious anemia in such gastritis. Also, this type is more common in the body of the stomach and it spares the antrum of the stomach. Okay, and this is a very rare variant in India. It is usually asymptomatic, and if it is in a severe form, then there are chances to develop your gastric carcinoma. Second is type B, that is infective or the infection that is caused by H. pylori or Helicobacter pylori bacteria. Now this is a spiral gram-negative urease producing bacteria. Okay, what it has is, it has an enzyme which is known as urease convertase, which converts the urea into ammonia. So this ammonia is a base, obviously. So this produces a local alkaline environment around the bacteria so that it protects the bacteria from the gastric acid which is present, and there is easy colonization of the bacteria in the antrum or in the body of the stomach. Okay. Usually this type is more common in the antrum and it spares the body. So it is opposite of type A. See, type A जो था, it was more common in the body, but this type B is more common in the antrum. Okay, and it spares the body. So this type of bacteria is there. फिर वो ऐसे, this is the mechanism by which this bacteria inherits your gastric mucosa and then it produces damage there. Second, type B, second type is, this is 1 or 2, whatever you can say. This is non-infective type, and almost type B and type C are almost same because दोनों ही non-infective आ जाते हैं. एक non-infective का इधर chief जो we'll say is, now this is your type B non-infective form is caused because of the regurgitation or reflux of the bile juice or the intestinal juice or the pancreatic juice back into the stomach. उसकी वजह से this is caused. And type C, which involves the chemical irritants, are the ones which we have studied in the acute form. That is your aspirin, NSAIDs, alcohol abuse, these forms. So actually the type B, that is the infection caused by Helicobacter pylori, is the most common cause of chronic gastritis. So that is chronic gastritis due to H. pylori is the most common cause. Okay, and in acute we have studied that the aspirin, NSAIDs and alcohol, these were the most common causes. Then again the next type is eosinophilic or allergic gastritis, obviously where the underlying cause is any kind of eczema or allergy or asthma. Then you have post-operative gastritis, and now there is a separate variant which is the last type, that is hypertrophic gastritis, also known as Manek disease. Now hypertrophic, as the word again is understood, atrophic means reduction, hypertrophy means enlargement. So there is enlargement of the mucosal folds, okay, and because of the enlargement, the gastric pits, they are what you say is enlarged, they become broad, and because of that there is hyperplasia of the mucus secreting glands, and so much hyperplasia, इतना ज़्यादा number में बढ़ जाते हैं that they even replace your chief cells or parietal cells, okay. So this type, this is another, or this you can say a varied type or a rare type of chronic gastritis. To the investigations, you have rapid urease test. तो इसमें क्या करते हैं, you take the biopsies and add this biopsy to a solution of urea which has phenol red added to it, and if there is H. pylori present, then as we mentioned earlier that H. pylori contains your urease enzyme, so this is going to convert or break down or split your urea to ammonia, and hence ammonia is a base, so the pH is going to be increased, and there is, due to the alkaline thing, there is obviously going to be a change in color that is going to presence the, क्योंकि हम H. pylori test why we are doing, because as I mentioned that chronic gastritis due to H. pylori is the most common form manifested as chronic gastritis. That's why अपन H. pylori test करेंगे, क्योंकि most common causes, every person who has chronic gastritis, so most commonly it is due to H. pylori infections only, okay. Next is staining. So H. pylori can be stained using your HNE stains or Giemsa stain. Also there can be culture of the H. pylori. More tests are there, like ELISA test hota hai, and there is stool test also to detect the specific antigen in the fecus. So these are all the tests, but these are the important ones. Moving on to the treatment. So again, as we have mentioned, क्योंकि वो type C, that is because of the chemical irritants होता है, so you have to avoid aspirin, NSAIDs and alcohol. Then because for the symptomatic relief, obviously you have to take the antacids or the histamine blockers, namely ranitidine 150 mg twice in a day or famotidine 20 mg twice in a day. And specifically for the treatment of H. pylori caused chronic gastritis, there are two things. One is a triple therapy or a triple regimen, that is for 1 week, and another is a quadruple therapy, that is for 2 weeks. Triple therapy 3 drugs, quadruple therapy 4 drugs. Now a short lame-see trick to remember this is like when you see a haunted place या आप कोई भूत देखते हो, तो obviously you start chanting Om 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 Om. Okay, you remember God first, right? So here H. pylori is the booth. Okay, here this H. pylori is haunting you. So obviously the medicine is going to start with Om, that is omeprazole. Okay. Now H. pylori is obviously a bacteria, so antibacterial has to be given, and antibacterial आपको पता ही है, it always has that streptomycin, penicillin and everything. So there is going to be clarithromycin, mycin वाला चीज is going to come. So this is an antibacterial. So when you chant that Om, that is omeprazole, and then you give clarithromycin, so the bacteria is going to run away with the speed of metro, that is metronidazole. So this is a lame short trick, but you can remember the medicines through this. Like omeprazole, chanting the Om 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 Om, antibacterial, that is clarithromycin, and then it is going to run with the speed of metro, that is metronidazole. Also for the quadruple therapy, here the BID is twice in a day, QID means 4 times in a day, and TID means 3 times in a day. Okay. For the quadruple therapy, you have 4. Okay. Also one more thing in triple therapy, that besides of metronidazole, so this is actually a standard regimen, you can say. Okay, this is a standard regimen. Baki sometimes hota hai, if person is allergic to this, then you can change things. Okay, in the quadruple therapy also, again the 3 things are almost same. Besides the clarithromycin, there is tetracycline. So you have to remember the 3 like this only. कि आपने ओम बोला भगवान का, you chanted the word Om to release the bacteria because you are afraid of the bacteria. Antibacterial, that is tetracycline, and then the bacteria runs with the speed of metronidazole. But for example, if there is a Muslim, okay, so he is going to, obviously he prefers saying Allah, so he'll say Bismillah. Okay, so from there you can remember Bismuth subsalicylate. Okay, you remember Bismuth subsalicylate, तो ये आप Bismuth याद रखोगे Bismillah से. Okay, that's also another name for God, no? So if not Om, then it could be starting with Bismillah or Bismit subsalicylate. Okay, so this way you can remember. So this is all about your gastritis, covering the acute gastritis and the chronic gastritis. This is a very important topic, frequently asked as short note or even as long note if only gastritis is specified. Otherwise, many a times chronic gastritis is asked individually or even acute gastritis is asked. So please be thorough with this topic, and I hope that you understood this topic. If you did, then please like, share and subscribe to our channel. Also hit the little bell so that you are notified every time we upload a video.